Nurses are the profession that is there when everyone else has left. And if you think about healthcare, especially in facilities, why does someone go to the hospital? They go there for nursing care.
How important is collaboration with other healthcare professionals, such as physicians or administrators?
We can't discount the power of one person. We are each very powerful with our voice, with our thoughts, and we can start that kind of ripple effect. But once you start that ripple, bringing other people in and having like-minded colleagues alongside of you just really amplifies our power. And so I think anytime that we can collaborate, we just gain strength.
What would you say to a nurse who is nervous, like you were when you kind of first started?
Figure out what you're passionate about. We have this very unique view of patient care, of the healthcare system, of what works and what doesn't work. And so without us at the table, you're missing a huge chunk of information and expertise.
Welcome to the Nurse on Purpose podcast, where we challenge media stereotypes about nursing and spotlight the incredible and diverse roles nurses play in healthcare. I'm your host, Mello. Every week, I'll be joined by a nurse who is reshaping the narrative. From frontline care to leadership, education, innovation, and beyond. Our aim is to show the world that nursing is so much more than what we see on TV. Together, we'll explore how we can collaborate with media and other stakeholders to create authentic and inspiring portrayals of nurses. Let's begin the conversation and ignite change, one episode at a time.
Hey guys, welcome back to the Nurse on Purpose podcast. This is where we challenge media stereotypes about nursing and we celebrate the diverse roles that nurses play in healthcare every day. Today I have a phenomenal guest and I'm so excited to have her on. I have a little bit of like celebrity crush on Melissa. So I have Melissa Mills, and she is a dynamic nursing leader with over 2 decades of experience transforming nursing education and workforce development. She's a passionate advocate for addressing nursing shortages, burnout, and the urgent need for innovative training solutions to improve care across the healthcare continuum. As the fractional executive director of the Commission for Nurse Reimbursement, she champions fair reimbursement structures for nursing services and actively empowers nurses to become powerful agents of change within the profession. Melissa is also a valued advisory board member for Power Up Nursing, a platform dedicated to advancing the science and spirit of nursing. And it's such a pleasure. I'm so delighted to have you on the podcast today, Melissa. You're so welcome.
Thank you. I am so happy to be here. So thank you for inviting me.
Thank you. So today our topic is really going to center around advocacy in nursing, the power of nursing voices, how nurses can shape healthcare policy through advocacy. But of course, I want to first get your story. I want to hear what led you into the profession of nursing and really your story up until this point.
Yeah, so I started in nursing, just like most of us do, at the bedside, right? I was a CNA in nursing school and then became a nurse, worked at the bedside, but I quickly realized or started to feel that working at the bedside, while I loved it, I didn't have the bigger picture and the ability to really affect change. And so when I started feeling this way, my first kind of step was into leadership roles. And that really gave me the ability to see the nursing and healthcare industry at a higher level. And then also still work with bedside nurses and in home care and hospice. So, nurses going into people's homes, really working with them to help them along their journey. And then ultimately, it's been almost 2 years now. I really started, I think we go through different phases of our nursing journey, right?
Yeah.
You're in different areas of life, your experiences are different. And so in 2023, I really had kind of lost my passion
Yeah.
for nursing and really considered not renewing my license.
Mm.
And that was when I found the Commission for Nurse Reimbursement. And they were Rebecca Love and Sharon Pierce are the founders. And they had put something out on Facebook or on LinkedIn, excuse me,
Mm.
had put something on LinkedIn looking for people to be co-chairs of committees. And so I was like, I'll try it. And
Yeah.
so I applied and was accepted and started working in as a volunteer on the business committee and really started to find my passion and my voice again
Mm.
around
Mm.
nursing.
Mhm.
And then ultimately, as we went through, well, I got laid off. That was another part of the story. So I ended up getting laid off and called Rebecca up, had like met her one time in a group setting virtually.
Oh, wow.
And she had given us her phone number. And so I called her and I'm like, can you use me? I am so bored because I wasn't working and I
Yeah.
had a severance package. And she was like, absolutely. And so I started really leaning into developing kind of the operations of the commission and then just started falling in love with the idea of using my voice,
Mm.
connecting with other nurses, helping them to kind of claim their power.
Yeah.
Because I think it's so hard sometimes for nurses, and maybe it's because we're primarily women, but it's hard for us to like claim that power and just be in that power to say,
Yeah.
I'm an expert and I know
Yeah.
these things that others don't about the nursing profession.
Yeah. That's so powerful. Going out of your comfort zone like that can be scary.
Yeah,
And reaching out to somebody who is like a powerhouse, right? In
yeah,
nursing, who you had
absolutely.
only met virtually. So I think that sometimes you have to sort of make that first move, and then
Yeah,
everything else starts to open up to you. It's about being courageous and just going for it.
yeah.
And so advocacy looks very different to different people, or it can take many different shapes. But a lot of times when you hear the word advocacy, the pictures that come to mind are like White House and legislature and policy. What does advocacy mean to you?
So that's a really interesting question because I have kind of two different sets of advocacy because you're right. It is about going and meeting with your representatives. And we've done a lot of that through the commission. And
Hmm.
I'll be the first to tell you, I was very nervous when I first started meeting,
Yeah.
people who are, health policy experts
Oh, yeah.
and legislators, but you quickly realize that they don't know what we know. And so
Yeah.
they really want
Depend
us
on us. Yeah.
to,
Yeah.
they want us to tell our story.
Yeah.
And so there's definitely that view of advocacy. But then I think there's also this advocacy that is just speaking up. It's
Mm.
just speaking
Hmm.
up and being in places where you can use your voice to advocate for yourself, to advocate for patients, to
Yeah.
advocate for other nurses. And so I think while it is this formal, I have to go to Washington, I
Hmm.
have to do all of these things, we also can do it every time that
Absolutely.
we speak about
Yeah.
nursing and the profession and what's happening in healthcare.
Absolutely. That is so wonderful. For those people that don't know what the Commission for Nurse Reimbursement is, can you speak a little bit about that?
Yeah, absolutely. So the commission was started in early 2023 by Rebecca Love and Sharon Pierce, as I said. And most people, it's interesting. Some nurses know this, some nurses don't, but nurses do not have a billing structure.
Yep.
So we are included in the room rate. And what that means is that if you know anything about business, you don't invest in costs. You invest in something that is going to give you revenue. So
Yes.
if you think about nurses, when we go to work in hospitals, nursing homes, we are not bringing funds into the facility by a billing code, like
Mm-hmm.
therapy,
Mm-hmm.
physicians, nurse
Mm-hmm.
practitioners,
Mm-hmm.
PAs. All of those disciplines have a billing structure. And
Yeah.
so we don't. And so what we want to do at the commission is we really want to change that.
Mm-hmm.
That the current billing structure was established over 100 years ago.
Wow.
And so for the last 100 years, there's never been there's been attempts, but there's never been a successful change to that billing structure. We believe that if we can pull nurses out of that room rate and really start to be able to bill for the skills and the highly skilled things that they do, tasks, actions, assessments, then we can start to bring dollars back into the hospital specifically to invest in the nursing workforce.
That is great. Can you talk about some of the efforts that you guys have currently on the ground and things that you've already been able to accomplish?
So we really have been in the awareness state, right? Really starting to get our voice out there. With publications, as well as going to Washington, D.C. to meet with health policy experts and legislators, elected officials.
Mm.
And then we've also really been looking at ways to increase our reach to CNOs and to nursing professionals in general.
Yeah.
And one of the things that we just launched, actually, we announced that we are starting a fellowship. So it is the Fellowship in Nursing Economics, acronym FINE. And in that program, it's a 1 year long program. Nurses will really start to learn from industry experts how to look at nursing as an economic driver and start to be able to find their voice. We're also going to talk about advocacy and innovation in that fellowship. And so
Yeah.
it's really going to give, there's never been a program that talks about nurses' economic power. And so
Yeah.
that's really what we want to teach people.
Wow. I find so much value in that. When you said for nurses to find their power, again, I think it's so important because we bring so much revenue to hospitals just by our day-to-day work because we are the largest healthcare profession, and we don't feel like there is proper compensation for that.
Right.
So this will really drive, I think, a lot of change. And I think this is really important work that you're doing. So I applaud you. I applaud Rebecca and the entire team. So I wanted to know that why is it crucial that nurses are involved in healthcare advocacy and policymaking? You talked about us having a unique perspective and us knowing things that these policymakers don't know, but sometimes we're afraid. Sometimes we have even 20 years of experience, and yet we are like, we don't know too much. We don't want to get involved. But why is it important that nurses are sitting at the table and are actively involved in healthcare advocacy?
So I think, and you said it very well, we are the profession that is there when everyone else has left. And if you think about healthcare, especially in facilities, why does someone go to the hospital? They go there for nursing care. Mm-hmm. And yes, we can do some nursing care at home, but we also know there are constraints around what we can provide in homes. And so when a patient goes into the hospital, they're really there for that nurse and for that assessment, for the skills that we provide. And so we have this very unique view of patient care, of the healthcare system, of what works and what doesn't work. And so without us at the table, you're missing a huge chunk of information and expertise. And I think it's funny because when I talk to nurses, a lot of nurses are like, well, I'm not an expert. but we are, right?
Mm.
We are experts. And maybe it's because, again, we're primarily a female profession, and it's hard sometimes for women to be like, I know what I'm talking about.
Yeah.
I am
Yeah.
an expert. But I think, that's why nurses need to be at the table
Yeah.
and need to not only be at the table, but to have a prominent location at that table and a strong voice so that we can help to design what's going to work for healthcare in the future.
Absolutely. When we think about advocacy, I think that it really does begin as students. How do you think that nursing schools can sort of evolve in their curriculum to begin introducing policy and advocacy to students to better prepare them for that role, for that engagement as they become professional nurses?
Yeah, it's so interesting. I actually on LinkedIn had a conversation and posted something about nursing education because someone had posted a comment to something I had posted last week and said that nursing academia is anti-innovation. And I thought that was really interesting because we kind of think as nursing education should be where we're, testing things and looking
Yeah.
at things and researching things. And I think we are, right? I really think we are. But I think you're right. That's where we really need to start engaging with nurses on such a different level because the nursing profession has changed so much even since COVID, right?
Yes.
Like
Yes.
so many more nurses are working in telehealth and I work from home
Yeah.
100% of
Tech.
the time. And so we have to start changing our curriculum to really meet those nurses where they are and teach them how to self-advocate, teach them how to advocate for the profession, teach them how to run businesses because there's so much nurses can do that we haven't fully tapped into and started using that as a resource to push healthcare forward and really start to meet patients where they are.
My podcast and my mission is about reforming media stereotypes and pushing that positive message out there. But I think that if the work is done internally, then there wouldn't really be a need to push so much because it would be completely obvious. And that's one of the major reasons why nurses need to really start being involved, being active. You know about the Woodhull study and how we're only 2% represented in the media, in journalism, as experts with giving healthcare opinions. And so I think the issue affects everyone because when I talk to all my guests, they feel the same way, but there's only a handful of people who are really doing and pushing and driving. So more people are needed in the spaces to truly create that buzz and just light the entire place on fire, right?
Right.
And we will be noticed one way or another, like it or not. But it's so key. Thank you for sharing that. Another great point that you mentioned was kind of, allies and collaborating. How important is collaboration with other healthcare professionals, such as physicians or administrators, and how important is their collaboration in effecting the change that we want to see in nursing?
I think anytime, we can't discount the power of one person, right? We are each very powerful with our voice, with our thoughts, and we can start that kind of ripple effect. But once you start that ripple, bringing other people in and having like-minded colleagues alongside of you just really amplifies our power. And so I think anytime that we can collaborate, whether it be with other nurses or with other professionals, we just gain strength when we collaborate with others. And that was one of the things that I really learned when I joined the commission, because I started to develop these relationships with other nurses and other healthcare professionals and policy people who are part of the commission. And it's almost like you get this tribe of people that have similar desires within healthcare and really want to affect change. And the power that comes in that connection, those connections, is amazing because you can really affect change on such a larger scale when you're not doing it by yourself.
Yeah, for sure. And, sometimes it becomes almost like a power tussle, but
Yeah.
I think that there's room for everyone. Doesn't have to be, the physicians and then the nurses,
No.
and then we really can all work together,
Yeah.
because elevating nursing does not diminish any other profession, right?
No.
It's an
Right.
effort all by itself. Yeah.
Absolutely. And if you think about it, there's 5 million nurses in the US. So imagine the power we would have
Yeah.
if we all had one talk track,
Yeah.
right? One, even if it was just one common thing that we all said or we all
Oh, wow.
worked on together. Imagine the power that we would have
Oh,
if we were
boy.
all united in
Yeah.
one area. So I
Yeah.
think you're right. And it doesn't diminish any other profession, because we all know, if you've worked, especially in hands-on care, you need the physician, you need that
Yeah.
therapist, the social
Absolutely.
worker. We are a team
Yeah.
effort, right? None of us can do this alone.
Melissa, you are the advisory board member for Power Up Nursing.
Yes.
Can you talk to us about that?
Yeah, so Power Up Nursing is this really great startup nonprofit looking at how to improve nurses' lives. And so we do a lot with, and we're a startup as well, but we're looking at ways to help nurses have healthy lifestyles. So it's really about the spirit of and science of nursing. And so we're doing things like programs in hospitals where nurses get, and I have one right here because I was charging mine. They get a ring, a smart ring.
Oh, that's cool.
And then this really starts to tell you information, data about your body and how it's working when you're under stress. And we know that nurses are under stress. So imagine if every bedside nurse had a way to go back and look at the data in their app that says, hey, you met these goals today, but you didn't meet these goals. And then how we can change how a nurse functions to be healthier, because we know that nursing is hard, right? And so giving them that power, that information, that data will help them to choose healthier lifestyle choices that will help them be more resilient on the job.
Oh, that's wonderful.
Yeah.
There's power in awareness. It's kind of like when you're trying to get on a nutrition plan. Sometimes you're like, oh, I eat so healthy. And then you start to track it. You're like, oh, God. I'm terrible. I can't believe how much sugar I'm putting in my body. And so that I guess that's the message I'm getting, is that Power Up is bringing more awareness to you so that you can make the changes that are needed for your body and, for you to thrive as a nurse.
Absolutely. Because even simple things like sleep, right?
Yeah.
How many, because yes, we are nurses, but we are dynamic individuals with lives outside of the confines of nursing, right? And so we've got children, we have parents, we have spouses and partners, and we have all of this, very dynamic life. And there's so much that we have to remember to take care of ourselves first. It's kind of like, put the oxygen mask on yourself before you put it on someone else. And so that's kind of what Power Up Nursing is really. How do we get nurses to understand that you got to put the oxygen mask on first if you want to be at the bedside to help your patients?
Wow. You know what I love? I love that your career sort of came full circle.
Yeah.
Prior to getting hooked up and connected with the commission, you were on your way out.
Yeah.
And now you're doing something that sort of bridges that gap and helps people to retain nurses so that they don't leave the profession. And you're trying to heal that part of the nurse that is burnt out, that is just tired and wants to give up, because you were at a point in your career when you felt that way. That's wonderful. And it like you came alive, right? You kind of like went from, I'm done, So just, you're glowing.
I did. It's so interesting because I look back at that journey now, and and it really started on LinkedIn. I mean,
Yeah.
it really started there. And I was at a point, like you said, I was ready to kind of just, because I do have a master's in healthcare administration. So I was like, I'll just go more straight business, right?
Yeah.
And just really tap into those skills and not nursing. But once I started to put myself out there, and I think that's what advocacy is, right? I just was like, I'm going to try it. I'm going to see what happens. And I started using my voice. I started posting. I started connecting with other people, even sending something very simple in a message like, hey, I really like what you posted about today. Could we get on a phone call? And just connecting with other people, that was really when I started to feel like I was in my power and really growing. And then I just wanted to help other people understand that it really just takes that one step forward.
It makes such a difference doing what you're so passionate about
Yeah.
versus just going through the motions and being taken care of when you're doing, because sometimes you might be passionate about something, but it gets to you, it can be overwhelming. And if you're not properly taken care of and our caregivers aren't cared for, they can still burn out doing what they're
Yeah.
passionate about. So yeah, I think that if you have a passion or something that you wanted to focus on, lean into that, go after it, make the connections. We've said LinkedIn so many times. We're like a walking ad for LinkedIn at
I
this
know.
point.
I know.
But the community there is great. And that, never be afraid, never feel shy. I've made so many connections at this point on LinkedIn that I'm like, I don't even believe that I didn't connect with these people earlier, because they're amazing people and amazing nurses, and everyone has been so gracious and, like you, just so kind to respond and just, hey, yeah, of course, I'll join you. I want to talk about it.
Yeah.
And it's all about supporting one another,
For
even
sure.
though, if it's just about reaching out and supporting one another and doing it for the profession and doing it for one another, it really does help us to grow and elevate as a profession.
Absolutely. And I think, and we've said this word several times too, and I was actually at a conference last week that we talked a lot about this. It's about connection.
Yeah.
It's
It
about
is.
connecting to another person. And a lot of times we're so focused on work. We're so focused on all of the tasks that we have to do that we forget to just honestly ask someone else, how are you
How are you?
today?
Yeah.
What's going on in your life, right? And really investing in each other.
Yeah.
And I will tell you that is one thing that I have learned from Rebecca Love too, is if anyone in this world is passionate about connecting and helping other nurses, it's Rebecca. She responds to messages and text messages and gives her phone number out to any nurse. She really, and I've learned so
Yes.
much about investing in other people just by watching what she does. And so sometimes I think we have to find those people in our lives that then you're like, hey, she's modeling a behavior for me that I find value in. How can I do that
Do
for
that.
someone
Oh,
else?
yes. Yeah, yeah, yeah. I love that. I'm sorry, I didn't mean to cut you off, but I was just like,
No. Yeah.
I really,
Yeah,
yeah.
it's all about having those role models and mentors in our life and
Mm,
then watching what they do and being
yeah,
like, wow,
yeah,
that
yeah,
that is what I want. That is what
yes.
I love about that person. How can I do that for someone else?
Oh,
And
yeah.
I think if you can just find somebody who you look up to like that and who you can then really start, they're modeling behaviors for you and they don't
Mm,
even realize it, right? They're
yeah,
doing it just as being an authentic person.
yeah.
And then you can start to embrace some of those qualities
Mm,
and mesh that with who you are. And then you also become this very authentic and powerful person to someone
yeah.
else.
And I would have to say that, you exemplify those traits as well and those qualities as well.
Thank you.
Because I see, and you know what? It's weird because I wore pink today. And sometimes I like to match the energy of the person that I'm going to be interviewing with the
Yeah.
colors. And I'm like, I kind of see you as this really sweet, kind hearted person. And so, it's awesome to see people who are leaders in their field not have airs about them like, oh, they have to reach out to me 20 times and, like
Right.
we have to wait in a long line. And sometimes we can tend to let our pride get in the way
Yeah.
when younger nurses are reaching out or wanting to kind of pick your brain or learn from you. And so this is a lesson for, well, everyone, that
Yeah.
you have the opportunity to be a valuable example, a valuable asset in someone's life by modeling kindness, thoughtfulness, mentorship, all of these things that bring, like you said, connection to other people. So I think that's wonderful. I'm so glad that the conversation took a different turn, but I'm glad it did.
Yeah.
So yeah, I do want to kind of pivot now to talk about media portrayals,
Yeah.
and just talk to you about what your thoughts are, and if you watch any shows. I know a lot of people are obsessed with Grey's Anatomy, but what are your thoughts about how nurses are portrayed in the media?
So I used to watch Grey's Anatomy when it was, very first started. And another show that I have watched is The Resident.
I love that
And
show.
I do too. And it's really interesting. I think one thing, and I'm sure most nurses are like this, right? You're watching a TV show and they portray a nurse doing something, and sometimes they portray doctors doing things that you're like, what?
No.
They would never be the one doing that, right?
Right.
And it's interesting because sometimes I think they portray nurses as being subservient to physicians. And like, we can't make independent decisions, and obviously we can. And then I think another thing that sometimes comes out is they portray nurse practitioners as not being in this provider level where they really should be walking right alongside of the physicians and the physician assistants because they are providers.
Yeah.
So I think it's just a media misstep in having someone who really understands the ins and outs of the nursing profession and what we can do to really show what nurses do every day and even what physicians do, right? Because physicians aren't the ones that are going to be pushing a gurney down the hallway.
No, but they always are the ones.
Absolutely.
It's funny. But yeah, I love that perspective. That show is probably one of the ones that I have appreciated so far. And one of the scenes, as you were talking about the nurse practitioner, Nick.
Yes.
One of the scenes that came up was when one of the residents, and there were two residents, they were doing some work on, I think Nick had just like saved the day or done something and taught the residents and all of that. And the first resident says to the other resident, hey, so, Nick she's really good. And the other one goes, you just noticed? And then the guy, to which he responds, why didn't she go to medical school? And then, right?
Yeah.
And then the other guy goes, well, because she's smart, right? She chose to be a nurse, and nurses have unions. They don't have to, talked about her pay and all of that stuff. Yeah. And then he goes, yeah, well, I still think she would have made a good doctor.
Yeah.
And I'm like, oh, terrible.
Exactly. Like, there was so much opportunity there, right? To be like, oh, she's a nurse practitioner and, she can do a lot of the same things that physicians can do, but she's doing it through the lens of a nurse who is, maybe a little bit more holistic in their thinking. And and I love her character, though. She is phenomenal.
Spot on, smart.
Yes.
One of my previous guests actually was called on by the producer of the show to help craft the nurse characters, which I thought was brilliant. So I'm like, oh, that makes sense.
Yeah,
That
yeah,
makes sense.
yeah.
But yeah, so we're wrapping up, getting to the end of our episode. I have my handy dandy jar. We're going to play a fun game.
Awesome.
Melissa, I know you're familiar with the game, but I will explain it for those who haven't seen or heard. I have a jar in front of me, and in this jar, I have several categories or genres of TV shows, movies, and the like. I will shake it around and pick one. And when I pick one and read your category, you have to come up with a plot line for your own show. If Melissa were to write a show, if Melissa were to, write a movie, whatever it was that had a nurse character, a nurse lead, what would that look like? Okay, ready?
Okay.
Okay. There are no losers here, okay?
Okay. All right. Only winners.
So you're the only one playing the game. Oh, this is cool. So your category is political drama.
Ooh.
Yeah, this is so
Right.
fitting.
It is very fitting. So I think it would be a nurse who maybe she starts out feeling a little uncertain of where she wants to go and what she's doing in her profession. And then something really big happens and she becomes this powerful advocate who is going to Washington and meeting with elected officials. And of course, we need some drama, some love and all of that sprinkled in there, like a really nice looking co-star, definitely.
Yeah.
But certainly her character, and I say her, not that nurses can't be men,
Yeah,
but
I hear you.
it would be a female since it's my show. It would be a female, and I think she would be smart and just really intelligent and maybe a little quirky, maybe a little eccentric at times, but definitely someone who really is passionate and intelligent and wants to change the world for good and for better.
Yes, yay! That's an awesome show. I love that show. It sounds very Olivia Popey.
Yes. Oh my gosh. Yes. For sure. I could
Olivia
totally.
Pope is a nurse. That's.
Can we get Kerry Washington to play that role too?
Oh,
yeah.
All right, Kerry Washington, if you're listening, we're sending the vibes up, okay?
Great. We need you to be the smart, powerful nurse. Yes.
We love that. Thank you so much. That was wonderful. Where can people find you and connect with you?
So definitely on LinkedIn. That is really the only platform that I have connected with at this point. And primarily because, like you had mentioned, the community there is so supportive. And I've just found so many connections. So definitely Melissa Mills there on LinkedIn, and then also the Commission for Nurse Reimbursement. It's a long name, but that is our website, commissionfornursereimbursement.com. You can find information about all of our work there as well.
Awesome. And last question, who would you recommend or suggest to be a guest on the show?
I think I would recommend, so there's two just amazing, actually three, amazing nurses that I have been working with at the commission who I met very early on as a volunteer, and they are all three volunteers. Shannon Lunn in Minnesota, Katie Davis, who is in New Jersey, and then Marini Kim, who's in Texas. And the commission could not be where we are today without their hard work, support, dedication. They're kind of the boots on the ground, making things happen behind the scenes. And they all have incredible careers and missions and work that they've done. And so I would say the three of them would be fantastic guests.
That's wonderful. Thank you so much. You know what? I did say it was my last question, but something just came to my mind and I do want to ask it. What would you say to a nurse who is maybe nervous, like you were when you kind of first started,
Yeah.
that wants to get into advocacy, that wants to be active in policy making and things. I know you started off as a volunteer, which is
Yeah.
great. It allows you to be involved in hearing and seeing, but sort of safe where you're not really actively
Yeah.
participating yet. How would you advise a nurse who wants to get into advocacy to go about it?
So I think the first thing is just to figure out what you're passionate about, right? Think about the things that keep you up at night, the things that you research, that you try to find more information about, because if you are searching, that's really where your passions lie, right? And then once you really understand the ins and outs of that topic, start finding other people who also talk about that. Maybe it is an organization like the commission. Maybe it is a large organization like the ANA, because they have, multiple areas of advocacy that they do. But start looking for those organizations and for people, and just reach out. You may not hear from every single person, but remember, it only takes one yes for you to start to gain traction, and volunteer your time, your energy, your expertise, and eventually things will just open up for you.
Guys, it's been such a pleasure to talk to Melissa today. Thank you, Melissa, for being here. I'm so proud of all your efforts with the Commission for Nurse Reimbursement, with Power Up Nursing, and I really applaud you and the entire team for what you're doing. Guys, give it up for my guest.
Thank
Alrighty.
you. Yeah, and thank you for inviting me. I appreciate it.
It's my pleasure. Thank you guys for watching. Until next time, bye-bye.
Thanks for hanging with me till the end. I hope you gained some valuable insight into the world of nursing. If today's episode inspired you, please like, subscribe, and share with someone who needs to hear about the amazing work nurses are doing. Let's keep breaking stereotypes and reshaping the narrative together. I'll see you next time.